Moving on to Chapter 20, Drugs for Parkinson's and Alzheimer's Disease. Parkinson's disease is characterized by rigid muscles, bradykinesia or slow movement, a shuffling walk, involuntary tremors of the limbs, postural changes such as head and chest move forward, a lack of facial expression, and a pill rolling motion of the hands. At its core, it is a neurologic disorder characterized by an inhibitory neurotransmitter of dopamine, acetylcholine, and while dopamine normally maintains control of acetylcholine and inhibits its excitatory response, in Parkinson's disease there is an unexplained degeneration of the dopaminergic neurons, and an imbalance between dopamine and acetylcholine occurs. With less dopamine production, acetylcholine is unopposed, causing excitation and stimulation of the neurons. With this increased stimulation, the symptomatic movement disorders occur. Our non-pharmacologic interventions are going to be exercise, nutrition, while our treatment regimen is going to include anticholinergics, dopaminergics, dopamine agonists, and MAO-B inhibitors. There will also be COMT inhibitors that inhibit this enzyme that inactivates dopamine. The dopamine receptor antagonists that act on the dopamine receptors themselves, as well as sometimes the use of atypical antipsychotics that are often used to treat hallucinations and delusions associated with Parkinson's disease psychosis. The anticholinergics are used to inhibit the release of acetylcholine, reduce the rigidity and some of the tremors, and have minimal effect on the bradykinesia. These drugs would have side effects like dizziness, anxiety, photophobia, blurred vision, ocular hypertension, weakness, tachycardia, GI distress, constipation, dry mouth, and urinary retention. The concept is to improve the patient's mobility. We want to obtain an accurate health history and assess baseline vital signs. We also want to look for cues such as decreased mobility, confusion, and have the patient with decreased involuntary spasms caused by Parkinson's disease. We want to do everything we can to lessen these spasms. We're going to counsel patients to take an anticholinergic, to have that routine eye exams because of the increased pressure within the eyes. It's also going to be contraindicated for patients with glaucoma. We want to encourage the patients to relieve dry mouth with hard candy, ice chips, or sugarless gum, and also monitor urine output carefully for any early detection of urinary retention. In the case of dopaminergics, you may hear of levodopa or carbidopa-levodopa. And this drug works to convert to dopamine and increase the patient's mobility. Side effects again, nausea, vomiting, involuntary abnormal movements, psychotic behavior, angioedema, palpitations, orthostatic hypotension, along with insomnia, blurred vision, dizziness, and headaches. A dopamine agonist is going to be bromocriptine. And this works to stimulate the dopamine receptors. Taken alone or in combination with carbidopa-levodopa, it has side effects like headache, fatigue, hypotension, rhinitis and sinusitis, GI bleeding, nausea, constipation, and hypoglycemia. In the case of monoamine oxidase B inhibitors, selegiline, this is a drug that inhibits the MAO-B enzyme that interferes with the dopamine. Again, you're noticing a lot of similarities in the adverse effects like dizziness, headache, confusion. In this case, hallucinations, depression, insomnia, as well as ataxia, nausea, constipation, and orthostatic hypotension. Just like with MAOIs, as we'll talk about in another chapter, we want to avoid foods that are high in tyramine, such as aged cheese, red wine, and bananas. For COMT inhibitors, these inhibit that COMT enzyme that inactivates dopamine. Dizziness, orthostatic hypotension, insomnia, confusion, hallucinations, and again, the nausea, diarrhea, abdominal pain, and constipation. Dopamine receptor antagonists like amantadine acts on the dopamine receptors themselves. Dizziness, headache, orthostatic hypotension, along with dyskinesia, dystonic reactions, muscle cramps, blurred vision, or even peripheral edema. Pimavanserin. This is an atypical antipsychotic that acts as a dopamine antagonist. It has side effects like confusion, hallucinations, nausea, constipation, infection, and peripheral edema. In precautions for drugs used to treat Parkinson's disease, often these drugs have a lot of side effects, so that the patient's going to take another medication to lessen those side effects. We want to do everything we can to improve the quality of the patient's life, but polypharmacy can quickly build up in these patients as well. A condition you've no doubt heard of, Alzheimer's disease. Keep in mind that Alzheimer's is a form of dementia, though keep in mind that all Alzheimer's is dementia, though not all dementia is Alzheimer's. It's an irreversible neurodegenerative disorder. We can do things to slow down the progression of Alzheimer's disease, but we can never reverse Alzheimer's disease. Alzheimer's is going to have 3 phases: preclinical, mild cognitive impairment, and Alzheimer dementia. It shows deficits in an impaired ability to acquire and remember new information, impaired reasoning and handling of complex tasks, impaired visuospatial abilities, impaired language functions, and changes in personality, behavior, and comportment. In the case of acetylcholinesterase or cholinesterase inhibitors, rivastigmine, this allows more acetylcholine within the neural receptors and increases cognitive function while slowing the disease process. Side effects include dizziness, headache, confusion, depression, dry mouth, dehydration, GI distress, weight loss, along with peripheral edema and orthostatic hypotension. Other options in the acetylcholinesterase or cholinesterase inhibitors are drugs that work directly on the amyloid monoclonal antibodies, such as lecanemab. In the case of rivastigmine, we want to assess the patient's mental and physical abilities and obtain a thorough history, including hepatic and renal dysfunction. In the case of all dementia patients, we want to maintain a consistency of care, record the patient's vital signs, observe any patient behavioral changes, and note any improvement or decline. We also want to teach family members about safety measures to avoid injury when the patient wanders, and inform family members of available support groups, as dementia is not only debilitating for the patient, it can be a serious hurdle and issue for the family as well. For our first practice question, which of the following should the nurse teach the patient's family about rivastigmine administration? Would that be A, administer without food, B, administer with meals, C, administer at 3 a.m. and 3 p.m., or D, administer when the patient is acting most confused? This is a drug that needs to be taken on an empty stomach, so we want to make sure that we're administering that without food. For question 2, which comment to the nurse indicates more teaching is needed for a patient taking carbidopa-levodopa? That be A, I know I need to take this drug once a day. B, I know I shouldn't stop taking this drug abruptly. C, I understand my urine may become dark and discolored. Or D, I know it may take a few weeks or months to control my symptoms. And that answer is A, I know I need to take this drug once a day. Question 3, which side effect, adverse effect of carbidopa-levodopa does the nurse realize is the most important to monitor? Is that going to be A, dysphagia, B, increased libido, C, granulocytosis, or D, urinary retention? That answer is going to be C, granulocytosis. This is another word for neutropenia, or when the patient's white blood cells get critically low. For question 4, before administering carbidopa-levodopa for the treatment of Parkinson's disease, which of the following history is most important for the nurse to assess the patient? Would that be A, pulmonary disease, B, diabetes mellitus, C, allergy to penicillin, or D, glaucoma? That answer is going to be D, glaucoma. Question 5. A patient with Parkinson's disease is being treated with carbidopa-levodopa. The doctor asks the nurse why he needs both agents. Which of the following is the best response for the nurse? That be A, the 2 medicines together are doubly effective. B, this combination has fewer side effects. C, you'll tolerate this better than a single agent medication. Or D, the carbidopa helps the levodopa reach the brain. And that answer is D, the carbidopa helps the levodopa reach the brain. And our final question. A nurse at an adult daycare center notes that many patients are on rivastigmine. Which of the following best describes the function of this medication? Would that be A, an increased physical mobility, B, to cure Alzheimer's disease, C, to slow the progression of symptoms of Alzheimer's disease, or D, to restore full memory to the patients? And that answer is going to be C, to slow the progression of symptoms of Alzheimer's disease. Remember, in the case of Parkinson's and Alzheimer's, there are interventions we can do that can slow the progression and extend that patient's life. But we'll never be able to cure it. We'll never be able to reverse those symptoms. We can only slow the progression. But anyway, that's all I got for this chapter. I'll see you in the next slides.